Handle with care. Handle with Care is a presentation designed to give general tips and advice to staff members on manual transfers and other methods of transferring residents in the safest way possible. A lot of facilities encourage the use of mechanical assisting devices wherever possible. While this is a good alternative, you will still have some residents who, for various reasons, require manual transferring. This presentation will address the benefits of good practices as well as the consequences of not so good practice to enable your staff to understand the importance of transferring correctly. Any facility using this training should review their policy and procedures to ensure consistency. In their everyday work, the CNA will do all of the above movements repetitively, so it's important that they know good techniques when it comes to transferring residents. It's important for all staff to know these statistics so that we do all we can to practice good techniques, as we seem to be in a high-risk category for back injuries. Once you have a back strain, you are never the same. It becomes a weak area that you have to live with, and it's something that could potentially affect your work and your life. Musculoskeletal disorders can mean more than just a bad back. Your posture, muscle tone, body strength, pain levels, reaction time, and mobility are all affected. The CNA is at high risk, and the more education and training the CNA receives will encourage that CNA to protect himself or herself and those around them. It's important that you know what your facility's policies and procedures are regarding transferring. All facilities are different, and their policies are different, so become familiar with yours. A multidisciplinary team could be formed to address safe transfer practices. This team can work together to ensure a safer working environment, and it can share ideas and experiences to benefit the whole facility. Good training is vital to reduce injuries and to maintain safety within the home. Staff should be strongly encouraged to attend training sessions on a regular basis. Follow your facility's policy and procedure regarding the use of a back brace. Always think before you transfer. Where are you transferring to? Have you provided a safe environment prior to the transfer? Is this a one-person transfer or two? Is your resident ready? Check all these things before any attempt to transfer anybody. A multidisciplinary team can work to provide a safe resident transfer program within the facility. The resident will certainly feel the benefits of being correctly transferred and repositioned. The resident will feel much more reassured about being lifted, which will make the CNA's work easier. This means fewer grievances and resistance to the staff and reduces the chances of falls or injuries to the resident. Staff will also benefit from safe practices. Reduction in staff injuries means less sick time with more staff at work on a regular basis. We all know how hard it is to work short-staffed. A reduction in staff injury is one way to reduce call-ins. Staff who are properly trained and carry out best practices are not so fatigued and, if not dealing with a lot of pain, produce a better quality of work, which can only benefit the residents. Always know what the resident requires to perform the transfer. Is this a one-person or two-person assist to transfer? All CNAs need to know what each resident's requirements are. It may be useful to keep an updated list at the nurse's station, but always refer to the resident's care plan to ensure you transfer that resident correctly. The staff needs to know where they can locate this information in a timely manner to avoid miscommunication and any risks of injury. The therapy department within your facility should be utilized regarding staff training and further training on appropriate transfers, as well as rehabilitation for the residents. Good teamwork will ensure transfers are being carried out safely and that all staff know which type of transfer to use on which resident. Therapy staff can help with residents' mobility and to work alongside mainstream staff in promoting mobility and good transfers. Therapy provides adequate exercise for the residents, which can help when it comes to transfers. Use therapy staff as a resource to ensure continuing safe transfer practices and get advice on what is best for the resident regarding transferring. Always follow policy and procedure and take care of yourself too, so you will be safe and injury-free on your transfers. Always assess your job first. Is this resident a 1- or 2-person transfer? Are they weak on one side? If so, which one? Are you familiar with this resident? Is this a nervous resident when it comes to transferring, or are they cognitively impaired? To where are you planning on transferring them, or are there any hazards on the floor? There are a lot of things to assess before you actually do anything. Always tell the resident what you're going to do before you do anything. This is especially important when transferring. If that resident doesn't know to move when you do, this could cause an injury, as well as add distress to that resident, who will then be frightened. Staff are encouraged whenever possible to save their backs and the rest of their bodies, and to use mechanical devices to transfer residents. If the resident is care planned to use a mechanical device, use the device rather than attempt a manual transfer and hurt yourself or the resident. It was care planned for a reason. Also make sure that you use the mechanical device correctly, following manufacturer's guidelines and the policy and procedure within your facility. Work well with your coworkers to accomplish successful transfers. Always be comfortable with the other members of the staff you're directly working with, and make sure you are all on the same page when it comes to the actual transfer. If in doubt, never attempt a transfer. Get help, get advice, read the care plan, but never ever transfer if you think there is the slightest chance it will not be successful. Here are 2 basic definitions about the transfer belt. The Gait belt is used in many facilities for resident transfers. Check the policy and procedure for yours. Some facilities have their staff use their own belts on various residents. Some facilities will have one belt used on one particular resident only. Be aware of your facility's policy on this. The Gait belt is a canvas belt used in routine transfers and helps prevent pulling and tugging on the resident's skin. Never use the belt from an ordinary pair of pants as a Gait belt. Never apply a Gait belt over bare skin, as this could cause injury to the resident. The resident should be wearing stable footwear to prevent slipping or sliding when being transferred. Again, tell the resident what you are going to do first. It is very important they understand the procedure. Holding the belt with an underhand grasp for tighter grip and control is more secure for staff and the resident. Always check that the belt is secure around the resident, as per your policy and procedure, before any attempt to transfer the resident. Here are some examples of when a Gait belt may not be used. Always check with your facility as to what the protocol is in these circumstances. Some general tips for transferring. Keep your resident informed. Use manual transfers when appropriate, and use good body mechanics. Keep your feet apart as a wide base of support. Bend your knees to take added strain off your back, and have your back straight when it comes to the actual transfer. Work close to your resident, as unnecessary space between you could throw your transfer off balance. Explaining what you plan to do to the resident improves the chances of them cooperating with you. Trying to transfer a combative resident is either virtually impossible or will be done with potential risk for injury of the staff member or resident. Always know where the resident is going to be transferred. Be ready. Have the chair in place, if that's where they will be transferred, so you and your resident know they are definitely moving from place A to place B. Be aware of your residents' abilities. How well do they bear weight? Do they understand what you plan to do and why? Do they respond better with certain staff than others? What health issues do you need to consider? Be aware of your resident's abilities. Tell the resident before you attempt the transfer. It's common courtesy, and letting them know what will happen reduces the shock when you move them. Check what they are wearing on their feet. Avoid an injury due to sliding in inappropriate footwear. Check your equipment. Are the wheelchair brakes locked? Do those brakes actually work? If the resident has one side stronger than the other, position the chair so that the stronger leg moves to the chair first. Move footrests out of the way to avoid potential injury. Check that the wheelchair is suitable for the resident to sit in to avoid unnecessary skin breakdown. Check to see that armrests are not worn to reduce chances of skin tears. Any faulty equipment needs to be reported immediately and should be deemed out of use until suitable repairs have been carried out. When transferring a resident, use the pivot technique if suitable so that you can enable the resident to move into position with you. Always look to see if your resident has a catheter or tubing that needs to be taken into consideration prior to a move. Never lift the catheter bag or tubing above the bladder, as this could cause a backflow of urine into the bladder. Never be in a situation where any tubing is pulled on or tugged, which could cause distress and pain for the resident. Be aware if a resident is stronger on one side than the other, and give positive encouragement to that resident to assist you as much as they can. When a resident has been resting and needs to get up, always allow a few minutes for the resident to sit up and readjust to the sitting up position. This will reduce the chance of dizzy spells or fainting. Make sure you and the resident move together. Leaving one of you behind may cause an accident, which could have been avoided if you had worked together. Remember, every resident is different. How you transfer one resident will be totally different as to how you transfer another. Some residents can assist more than others. Make sure your resident is comfortable once the transfer is complete. Talk to your resident throughout the transfer so they know you know what to do, and make sure they feel safe with you moving them. Allow time for the resident to rest if required. Some residents tire very easily just from being moved. Never pull on a resident from behind to reposition them. You could cause an injury to that resident or, indeed, pull a muscle yourself. It is not good practice to pull under the arms because you could cause injury, such as a dislocated shoulder or even a fracture. If a resident is a mechanical transfer only, do not attempt a manual transfer. There is a reason that that resident has been assessed for a mechanical device. Never transfer when the resident or other person assisting you is not ready, as this could cause the resident or you to fall and become injured. Transferring without the needed assistance, just to save time, could just break your back or cause serious injury to your resident. Make time to do it properly. Hurrying isn't worth the risk. Always transfer with someone who is around your height, keeping things balanced. Never transfer with someone with whom you aren't comfortable, or if you don't know how well they transfer. Be familiar with the resident you are about to move and never rush. Rushing could cause an accident that could have been avoided if you had just taken those few extra minutes to complete the transfer properly. If a resident becomes injured, it is your duty to report that incident immediately. That resident now needs assistance other than the transfer and may need medical attention. Stay with the resident. Try to keep the resident calm and send someone else for assistance. Do not move the resident until assessment of the injury has been made. Learn from it. If you have made a mistake, never repeat it, and be even more aware of the importance of following policy and procedure. If you get hurt, stop causing more injury to yourself and get someone else to complete the transfer if necessary. Report your injury immediately and get medical attention if necessary. Look after yourself and look after your residents. Always transfer correctly, and be aware of the importance of lifting and transferring correctly. Your residents depend on it.